Well, my friends, this is another case of a carcinoma of the buccal cavity. There is definite history of chewing tobacco in the form of khoini. This gentleman is it about 41 years, a railway workman, used to take a large numbers of khoinis every day, and the result of which he has developed now presently this carcinoma of the buccal cavity. It has been spreaded at the outer side of the buccal cavity, but it has originated from the inside of the mouth cavity, inside of the buccal cavity. So, including the floor of the mouth, so there is ulceration near the second lower last molar tooth. Every day, now and then, government appealing, various NGO, non-government organizations are appealing with the physicians for the benefit of the society, every time advising the patients, the general public of the society in different ways, either direct advice from the clinic or many physicians giving advice in the form of writing in newspapers, magazines and journals. Many physicians are involved with many YouTube channels organized by various companies or individual persons. But in spite of that, person are taking tobacco regularly, taking alcohol regularly, result of which they becoming victim of lung cancer, carcinoma of the buccal cavity, cirrhosis and carcinoma of the liver, Buerger's disease, and so on. May I request once again, my friends, please devoid of all these tobacco substances to maintain the free, normal, and healthy life. This person has been suffering from carcinoma of the buccal cavity, which is metastasized, and slowly and gradually he will go to the black hands of the cruel death. Now, about for junior homeopathic physicians, I am telling about this disease. What is buccal carcinoma? The carcinoma of the cheek, alveolus, and floor of the mouth together is known as buccal carcinoma. They are grouped together for their close proximity and for almost similar line of treatment. The predisposing factors, what are the causes behind it? The predisposing factors, already I have told, chewing of tobacco in different ways, in different forms, leukoplakia, chronic irritation by racked tooth or ill-fitting denture, excessive smoking, excessive drinking of hard spirit, highly spiced food, oral sepsis, and of course addiction of quinine are the main predisposing factors of such carcinomas grows. Khoini is a mixture of raw tobacco and slaked lime. Khoini is not only the tobacco, it is mixed with slaked lime. So, it is the indigenous tobacco preparation in the form of pellet and gingivo-buccal sulcus. They kept it in the gingivo-buccal sulcus or between the lower lip and alveolus. So chronic irritation gradually begins, and perhaps carcinogenic property of khoini leads to epithelioma of the buccal cavity mucous membrane. Therefore, carcinoma of the cheek is fairly common in these parts of the mouth cavity. Its incidence supersedes that of carcinoma of the tongue. The carcinoma of the buccal cavity supersedes than carcinoma of the tongue on reason due to taking khoini, because khoini is nothing but the mixture of lime and tobacco both. Now, what are the symptoms you will get, you will find, and you will have to confirm the diagnosis, my friend. Elderly males are the common victims. In India, males and females are almost equally affected. It appears as a chronic ulcer or a broad-based wart or inner surface of the cheek near a gingivo-buccal sulcus. It may be associated with leukoplakia, as already I have told. The tumor gradually invades the whole thickness of the cheek and erupts to the skin surface to form a buccal fistula. How it has come out? It at first formed on buccal fistula. The neighboring gum, alveolus, and jaw are eventually invaded. The tumor metastasizes to the submandibular and upper deep cervical lymph nodes. Blood-borne metastasis is very uncommon, however. A late case of carcinoma of the cheek may be confused with cellulitis of the face or osteomyelitis of the jaw. The tumor is well visualized after opening of the mouth, as I have shown. So, carcinoma of the buccal cavity is very dangerous and very injurious, and probably the most important cause is khoini addiction. Now, what will be our treatment in this case? This patient having tongue is salivated, indented, জিভ দেখাও বড় করে, tongue is large and totally salivated. There is horribly offensive coming from the mouth, and so the prescription is mercurius, no doubt. It is an anti-syphilitic medicine, and some of the other symptoms are also covering mercurius. So I do like to prescribe mercurius in 50 millisiemens scale of potencies with the direction twice in a day, morning and evening, and let's see the result, how far progress we may expect from this greatest anti-syphilitic made by Hahnemann.